Welcome to CQ Hills Dental Toothday Tooth Tip. Today, I'm answering a common question. My tooth broke. What should I do? There are a few things to consider. First and foremost is pain. If your tooth is extremely painful and it's throbbing, you need to treat the pain first. That means root canal therapy or extraction. Root canals are excellent for saving teeth, and it's a good idea to avoid extraction unless it's a tooth you don't use. You've said it cracked or fractured, so assuming it's a tooth you chew with. Trying to save it would be a good idea. If the tooth is not painful or infected, it's had a root canal, then we need to deal with the fracture itself. There are three kinds of fractures, from bad to worse: horizontal fractures, oblique fractures, vertical fractures. Horizontal fractures have an L shape, and depending on where the fracture is, prognosis is generally fair. The only exception is when the fracture is below the gum or worse, beneath the bone. In most cases, if it's below the bone, the tooth is not restorable. If the fracture is at or above the gum line, then it's easy to restore because we just need to replace whatever tooth structure is missing and prepare a crown. I never restore fractures with fillings because the fracture occurred for a reason. Fillings are never as strong as the original tooth structure. The fracture will just happen again. I usually recommend full gold in fracture cases because it's very strong and it wears extremely well. Gold is so strong because it's malleable. As forces impinge upon it over time, it changes shape as opposed to breaking. As you get older, it will literally change with you, changing shape as the rest of your teeth change around it. Other materials are okay too, but if it were my mouth, it'd be full gold. Ting! Oblique fractures can vary in their prognosis. Oblique means angled, so the fracture will look something like this. Again, if any part of that fracture dips below the bone level, we cannot restore the tooth. Occasionally, we'll remove some bone to restore an important tooth like a canine, but this is usually not the best idea. We want to preserve bone in case the tooth is lost, and you want to replace it with an implant in the future. This is why I say non-restorable, because while techniques exist to do that, today I would just have your tooth extracted and replaced with an implant in most cases. Restoration of oblique fractures is similar to horizontal fractures. We replace the missing tooth structure and prepare a crown. Vertical fractures are not restorable. Think about tearing the side of a bag of chips. What happens? The tear just keeps on getting worse and worse. It's usually best just to empty the bag into a bowl and eat it that way. In the case of the vertical fracture, your tooth is toast. The reason vertical fractures have such a poor prognosis is the impact it has on the surrounding tissue or periodontium. We could invent different MacGyver methods of restoring the teeth, and they may work. Teeth can be hemisectioned and made into two teeth, each getting a separate crown. Why have I never done this in my dental career? It's, sorry for this, bad for the bone. I hope this information helps. Fracturing a tooth can be scary, but in a lot of cases it's not too bad a prognosis. See you next time for another Toothday Tooth Tip. Welcome to another episode of CQ